Hello, good afternoon. My name is Perla Rangel, and the people that helped me out with this research were Miranda, Estrada, Daniela, Castillo, Lilia, Izaguirre, and Villafana. Our research was about the coronavirus of 2019, or as many people know it, COVID-19. What is the coronavirus? From what the public knows as COVID-19 is an infectious disease that can be transmitted from one person to another. The World Health Organization explains that most people infected with the COVID-19 virus will experience mild to moderate respiratory illnesses and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illnesses, and in worst cases, the virus can lead to fatality. The spread of the virus can be prevented by following the CDC guidelines. The guidelines include staying 6 feet apart from others, washing your hands, wearing facial coverings, and staying at home as much as possible. There's also, if you go outside, try not touching your eyes, as it can help prevent the virus. And kids under the age of 2 shouldn't be wearing masks because it prevents them from breathing. How did COVID-19 begin? The virus is thought to have a zoonotic origin. The virus that caused the outbreak is known as SARS-CoV-2, a virus that is closely to bad coronaviruses, Polongian coronaviruses, and SARS-CoV. The scientific consensus is that COVID has a natural origin. The bad-to-bad human infection may have been among people processing bad carcasses and guano in production of traditional Chinese medication, which led to the coronavirus being a worldwide pandemic with many killings right after the Spanish influenza.
My name is Michelle, and I will be doing the next 3 slides. Where did corona come from? Experts say it originated in bats, which is also how behind the Middle East respiratory syndrome got started and other syndromes. It made a jump to humans in Wuhan's open-air wet markets. Customers will buy fresh meat and including animals that were killed on the spot. Crowded conditions can lead to the viruses from different animal swab genes. When did coronavirus begin? We learned about this particular virus shortly after a cluster of severe pneumonia cases were reported on New Year's Eve 2019 in the city of Wuhan, China. New evidence suggests that the earliest cases of COVID-19 were seen in November, but we are still learning about the origins of the virus. On March 11, 2020, the novel coronavirus disease COVID-19 was declared a pandemic by the World Health Organization. On March 13, 2020, a national emergency was declared in the United States concerning the COVID-19 outbreak. Disadvantages of the coronavirus. Many people are not following the COVID-19 safety precautions. There is a limited space in hospital for those with COVID-19, loss of jobs and income. The economy is suffering. Death rates and infection rates continue to rise, and many community leaders refuse to put their people's health and safety as a priority in order to keep the economy stable.
Daniela Castillo, there are no advantages of the coronavirus, but here are some upsides and ways the community is working together. Researchers, scientists, and medical professionals are all collaborating to find solutions. There are more face masks available to the public. More stores and restaurants are implementing rules to require customers to distance themselves and wear facial coverings. People are staying home to prevent the spreading of the virus. Current research on COVID-19. Researchers have created more than 3,000 variations of the protein that the coronavirus uses to latch onto its target. Before the virus invades a cell, a protein called spike fastens tightly to a receptor that is on the surface of many human cells. Researchers altered a single amino acid at a time in a key segment of spike to produce 3,804 variants of the protein. Results showed that many of the variants bind to the receptor of the protein in the virus, causing the current pandemic. This research could develop molecules that naturalize the virus's ability to infect cells. Some testing strategies include the serologic algorithm, choosing a test with high specificity 99.5% or greater, testing people with pretest probability of having SARS-CoV-2 antibodies, or orthogonal testing, which is when a person is tested a second time. Continuation of testing strategies. Representatives from the CDC, FDA, OSHA, and many more are working together to determine whether the serologic tests are indicative of protective immunity against SARS-CoV-19. The work includes assessing the levels of antibodies required for protective from reinfection, the kinetics of antibody responses, and many more are still being developed. Some tests may exhibit cross-reactivity with other coronaviruses, for example, a common cold which could result in false positive test results. Some people may not develop antibodies after the virus infection, and others, the antibodies may wane over time, which becomes undetectable. IgM and IgG are not present in early infection, which causes serologic test results to not indicate with certainty the presence or absence infection of the virus.
My name is Lilia Izaguirre. U.S. death rates versus global death rates and the Rio Grande Valley death rates. The U.S. death rates, we have 2.42 million confirmed, 743,000 recovered, and 124,000 deaths. Global death rates, we have 9.33 million confirmed, 4.68 million recovered, and 479,000 deaths. Rio Grande Valley rates, we have 4,354 confirmed, we have 1,879 recovered, and 79 deaths. Did the U.S. take the necessary precautions? The U.S. took necessary precautions around April this early by implementing rules and precautionary measures. These precautions were able to put into effect to reduce the chances of being infected of spreading COVID-19. States and communities all had different ways to take precaution, including closing businesses and putting cities under lockdown. The main ways to protect yourself include washing your hands, avoiding close contact, which is staying 6 feet apart, using face covers, and staying home. On the other hand, the U.S. president left the choice on whether to reopen their states and uplift safety precautions to state governors. On June 3rd, Texas Governor Greg Abbott opened the state of Texas and very much relaxed safety measures in an attempt to save the economy. The repercussions of that decision show easily by the rapid rates of death continuing to rise daily in Texas. Nonetheless, Governor Abbott plans to begin opening schools this fall 2020, putting students at risk, which is not taking the necessary precautions to stop the spread of COVID.
Hi, this is Miranda, Estrada. Minorities and the virus. The CDC has stated online that the effects of COVID-19 on the health of racial and ethnic minority groups is still emerging. However, current data suggests a disproportionate burden of illness and death among racial and ethnic minority groups. For many people in racial and ethnic minority groups, living conditions may contribute to underlying health conditions and make it difficult to follow steps to prevent getting sick with COVID-19 or to seek treatment if they do get sick. Members of racial and ethnic minorities may be more likely to live in densely populated areas because of institutional racism in the form of residential housing segregation. People living in densely populated areas may find it more difficult to practice prevention measures such as social distancing. Housing situations in minority groups plays a big factor, as well as belonging in a lower income social class. Many industries have not halted work hours or placed unemployment accommodations, so many minorities are forced to continue work in poor sanitary conditions, causing higher death and infection rates. Especially in times like now, during the the Black Lives Matter movement, more and more racial ethnic groups are getting together in order to seek justice against police brutality, and while seeking justice, they are gathering in very densely populated protests, peaceful protests, in which in turn could be causing even more infection rates to go up. It's even tougher when the majority continues to aggravate the minorities, causing even more protests and more situations in which they can no longer be peaceful, causing more and more contact between people. Not only that, but certain people like upper class and celebrities are being able to get tested before minorities in the lower class and middle class citizens because they're more, considered more of a priority. And, like the longer you wait to get tested, the more people you can infect just by doing pretty much everyday life things, not just protesting, but by going to the store, walking around your neighborhood, and having contact with friends and family, and not following the CDC guidelines, like any of them. So there's that. What do we think about the coronavirus? My group and I pretty much all collectively agreed that everyone should be following the CDC guidelines as much as possible, and be a little more responsible as thoughtful citizens. Also to remain social distancing. I think personally it's very easy and kind of common sense just to put others' health into consideration and not just your own. I mean, everybody has the right to not care about their own health, but just to be in consideration of others, you should wear your mask and do what you need to do, because your mistakes can obviously affect a huge group of people. So we pretty much collectively think that we should all be a little more responsible in dealing with the situation of the coronavirus in our community and country. Okay, next slide. How has the virus affected our studies? I think our group also kind of pretty much agrees with each other that having online classes compared to classes taken in person is a big switch to, come over. And it is definitely an obstacle, but it's something that we've had to adjust to in these times. Just because, obviously, taking in real-life classes is not a good decision considering the virus. It also prevents us from having a more clear communication with our professors and fellow peers and classmates. So there are definitely many disadvantages from taking an online class compared to an IRL class. Then this last slide is the list of all of our citations and sources. So that's it. Thank you.